The first step in the ACS algorithm involves the patient, lay rescuers, and medical personnel recognizing the warning signs of ACS. Studies show that women often present with symptoms that may be different from men, and they may delay care.
I just took a basic first aid and CPR class at work and learned that heart attacks can have different symptoms. And even though Mom objected, I went ahead and called for help right away.
As I worked through the symptoms with the caller, I determined that the person fit the protocol for ACS, which required a high-priority EMS response. In our system, we elevate suspected ACS calls to get a team to them faster.
While emergency medical services, or EMS, are en route, dispatchers may advise patients to chew 162 to 325 milligrams of non-enteric-coated aspirin, but only if the patient has no history of either true aspirin allergy or gastrointestinal bleeding. That brings us to the next step in the ACS algorithm: assessment, care, and hospital preparation.
Hi, I'm Claire. This is Rick. We're here to help you. Can you tell me what your name is?
Margaret,
Okay, Margaret. Can you describe your pain?
my stomach really hurts and my jaw hurts too.
It started about 20 minutes ago. I gave her an adult aspirin to chew.
Okay, we're gonna help reduce that pain.
Pulse ox is 88. I'm gonna get her on oxygen.
I'm going to get a 12 lead. Margaret, is it okay if I unbutton your shirt so I can place these leads?
Okay.
In this case, the highest priority is to obtain a 12-lead electrocardiogram or ECG, manage the symptoms, and initiate transport as soon as possible.
And every minute matters. The sooner we get the patient to the hospital, the more likely they are to survive and avoid suffering long-term effects. And whenever possible, we take patients with a STEMI as quickly as possible to a hospital that performs primary percutaneous coronary intervention, or PCI. PCI uses a catheter to open the blocked artery.
Looks like a STEMI. I'll alert regional medical and I'll transmit the ECG to the receiving hospital.
I'll get the stretcher. Recognizing ST segment elevation on a 12-lead ECG is critical because different thresholds exist for patients depending on their age and gender. Thankfully, our team is well trained and has lots of practice.
This early ECG helps classify patients suspected of having an ACS into two groups on the basis of ST segment deviation before they reach the hospital. This initial ECG speeds the patient's diagnosis and shortens the time to reperfusion.